practice owners, if you're looking to unlock an extra $50,000 in profit, build a high-performing team, and reclaim 5 or more hours a week, then you need to join me for the 555 Challenge from the 24th of March to the 28th of March, 8 a.m. to 9 a.m, 1 hour a day. In just 5 days, I'm going to show you the exact strategies successful clinics use to increase revenue, fix recruitment struggles, and optimize pricing without adding more work. Spaces are limited, so click the link in the show notes to secure your spot and start transforming your practice today.
One of the things in business that's a frustration is if you're paying more than you should. I've always thought that accountants and bookkeepers are really well placed to cross-shop and tell me, am I being ripped off? Or could I do better on this particular type of agreement? Do you do anything in that space, in the bookkeeping?
Yes. So we do work with a couple of suppliers as well. And I'll walk you through an example. If you've been signed up for your insurance, your business insurances, management liabilities, public liability, all those insurance, you've signed up and you've just renewed it every year. Been paying a fixed amount. And then what I have noticed is sometimes when we jump in, we quickly have a look at it and we're like, oh, actually you paid $12,000 this year on your insurance for this stuff. Now, when it comes to insurance, sometimes you might not have a cost saving, but you can pay this amount. Let's assume you're paying $12,000 for the year and get more value.
Welcome back to the Scale My Clinic podcast. And today we've got part 2 of the General Practice Financial Operating System with Ryan Sela, GM of GP Bookkeeper. Welcome back, Ryan.
Thanks, Todd. Nice to be back here again. And hopefully we'll have some useful conversations here today as well.
Absolutely. Now, last time we were talking about the model that you use to get towards the profitable practice in the center of this triangle model you were talking about. And we just finished talking about the importance of clean data. So I'm going to hand back to you as to what comes after having that foundational layer set.
Thanks, Todd. So starting with clean data, and then we wrapped up with how financial information relates to non-financial information and how it all interconnects and drives the financial stability of your business. The next part that I would like to focus on is the reporting side of things. Now, usually what I commonly see in general practice is either you do get some fancy reports, and this is from your bookkeeper or your accountant. You might start getting fancy reports on a monthly basis, a quarterly basis, every 6 months or once a year. And this is usually just emailed to the owners or a manager, and there is no sort of discussion or anything taken place. I think that's one of the critical areas because as an owner, you want to know how the wheels are turning in your practice. You want to know every element. And this is something that's not been done. It's fallen apart. And every practice manager or business owner I speak to, they tend to say, hey, we catch up with our accountant during a tax time or when it's necessary during year-end time. And in my perception, I don't think that that's the right way to go about things. I think it's important to keep the pulse on your financials on a more regular basis. And what I mean by that is you need to have some reporting going through at least weekly or at least fortnightly. But definitely you want to know your management reports on a monthly basis. There's absolutely no point looking at certain stuff on a quarterly basis. 3 months has passed by. You've got another, and if it's the start of the year, you've got another 3 quarters left. But by that time, almost 3 months in with 9 months remaining. So whereas if you're looking at it more regularly, maybe if weekly, fortnightly, or monthly, you can make certain decisions, you can take certain actions to prevent certain measures. If it's a cost, if it's a revenue that's been impacted, all those levers can be pulled when you look at things closely. And commonly, Todd, what I've seen is there are people out there who do send these reports out there, but again, no commentary or no story, which again is a massive loophole because in my experience, when people tend to get this, they look at it seriously for maybe the first couple of months, and then they ignore that email from the accountant. There's no value or no sense to it.
So one of the things I've seen, Ryan, when talking to owners about how they're doing financially with their management reports, they'll often say, oh, I wait for my accountant to tell me, or they're using the BAS, the quarterly BAS reports as their kind of financial data. And so you mentioned that people should consider weekly, fortnightly, monthly, and quarterly reporting. Could you just talk a little bit more about what people should expect at, say, for example, a weekly report versus a fortnightly report versus a monthly and quarterly report? What's the difference in those reports? And if I'm an owner, what would I be expecting at those reports?
So a couple of recommendations from my end would be on a weekly basis. You want to look at some key KPIs, how many appointments, how many doctors for that week that went by. So how you want to track it, Todd, is you want to run reports from Monday to Sunday and look at these the following Monday. You don't want to any longer. So if you are a practice who is targeting private billing, if you are a practice who is spending a lot on marketing, you want to track those new patient numbers, you want to track those private billing percentages, the appointment numbers, the number of patients walking through the door for the previous week that's gone by. That are in the medical practice, you do get certain slow periods as well, and it's important to prepare for them. Come April, come Jan, come December, you see those months slowing down and you want to prepare yourself, and that's keeping a pulse on it. If you look at those numbers, say, on a quarterly basis, that's 3 months gone by and you have no clue. So I would recommend something like that on a weekly basis, those appointments, the GP hours, those average patients per hour, and then come on a fortnightly basis. You want to keep a track of your cash flow. And what I say that is, that's when you are paying your creditors. That's when you're paying your staff. So usually, commonly what we see is the cycle of paying your creditors, the cycle of paying your staff, and even the doctors these days. Like if the practice is making the distribution to the doctors, it's moved away from monthly to fortnightly. They prefer more regular payments as well. And that's when that cash flow analysis on a fortnightly basis becomes crucial. Monthly, you want to get an idea of the entire financials, the numbers of your practice for that month. How did you perform from a revenue perspective? What were your biggest cost items? Sometimes we do get a couple of months in the year where we have 3 pay cycles coming through. Are you well prepared? So that's when the cash flow on a fortnightly basis will help, and then keeping a track on a monthly basis on your entire finances that took place that month. And then you want to assess and you want to analyze against a budget come on a quarterly basis as well. How did you track? What were your targets that you set at the start of the quarter and have achieved it at the end of the quarter? And then it's important to have that discussion, have a bit of a narration of what went on in your business those 3 months and targets for the next quarter as well. So those are the couple of things that I say it's important during that weekly, fortnightly, monthly, and quarterly basis.
And Ryan, you touched on, you sort of said that invoices should be managed every fortnight as well. And so does that mean that your payment cycles are kind of compressed to one day in the fortnight that you actually do everything on, and you move the money all at one time, rather than the common thing would probably be that things come in and people pay them or set the payments for the due dates, etc. Okay, great. And then one of the other things that has been a bugbear in businesses that I've owned in the past is that invoices may go to a variety of different people or emails, or sometimes they get CC'd to everybody. And the worst part, of course, is it goes to everybody. Nobody's accountable. And so they're kind of not in the system. And then you get somebody ringing you and saying, hey, listen, why haven't you paid X, Y, or Z? How do you get around the problem of invoices going everywhere and not really being a structured queue, metaphorically, so is that what you owe, when it's due, you're on top of all of those?
Definitely relying on a system. So I will be touching on a couple of systems that I think is crucial for general practice. However, the question that you asked, Todd, how do we manage this in a more proactive way? In the past, people tend to manage their bills on they'll put an Excel spreadsheet together, list down all their suppliers that they're working with, or they would have a common email. So this would be an accounts email or a finance email. And that would be where all the invoices will be sent to. And then you would see a manager or a bookkeeper from there extracting it into their accounting platform. And again, not regularly making those payments, but ad hoc when it's important. However, there are systems out there, and I might just touch on 2 systems which I will highlight later on as well, and that's Dext and HubDoc. They're pretty well-known platforms where HubDoc is a free version provided through Xero, and Dext is a paid version. So these platforms help where the suppliers can directly send those invoices into those platforms, and then it can have an approval workflow in place where it goes to the manager, ideally the manager. And if it's a medical supplies invoice, it would ideally go to a nurse, because they're the ones who are driving the orders. So they would have the first approval, and then we can have the manager have the second approval. So ideally, you want to get in touch with your suppliers, give them that particular email address. So it can be done through these systems usually have a unique email address. And when they send that particular invoice, that system scans the invoice and the manager or the nurse in place just has to approve it. Then it gets pushed automatically into the accounting platform, which a bookkeeper or the accountant would look at. Ideally, some get that in my experience, some payments might get missed, and that's because as an owner, you might have payments going through a credit card or you might have direct debit set up. In a situation like that, there might be a chance of having double payments as well. At the start, it's important to make sure that we get a list of what's going through your credit card. What are the direct debits that you have in place in your bank? And another small tip I would recommend is once you figure out that list, you want to code those suppliers in your accounting platform saying that, hey, this supplier is actually paying through credit card. This is actually paying through a direct debit. So when you're actually making that batch payment, you don't pick those suppliers up. But overall, Todd, you want to rely on a good system. And those are the two systems I recommended at the moment because manual work, you don't want to spend time scanning stuff and signing off on things. And that's going way back. Whereas now things are way too much.
Yeah, that sounds great. It might actually be a time just to talk about an area that I've certainly come across in practices whereby there's some fraud or false suppliers or changing the banking details on a supplier. Somebody who's either working the books or it may be somebody who's a practice manager or somebody in admin that's kind of had tough times and decided, you know what, I might just see if I can redirect some of those payments to me. How do you counter that, Ryan?
Again, in the industry, we work with very similar suppliers. So when you see an uncommon supplier come into play, it's important that you first of all do an ABN check. You want to verify the business details by doing an ABN check. Second of all, it's important that if it's a new supplier, you want to verify the bank details as well. So first, you would have a conversation with the manager or the owner. Mainly, it goes to the owner because it's money being paid to a supplier. You don't want that sort of approval done by a manager because just eliminating unnecessary risk there. Whereas as an owner, they would know clearly exactly what's going on. So you would get in touch with the owner and say, hey, I've got this new invoice come through. Seems to be a new supplier. I've done an ABN check, looks all good, but I just want to verify whether this person actually did work in the practice as well. And I'm all them and do a verification on their bank details as well. So once they give you an approval saying, yes, Ryan, this person actually came in, it was a plumber who fixed something in the practice. Okay, that makes sense because on the day they could randomly call up a handyman to do some work. And then you want to make sure that from our side, what we do is we fire a phone call and say, hey, we've actually received this invoice. These are the bank details. We just want to confirm that if it's all correct and verify all those details before that payment's made out. So those are a couple of tips that I can suggest because you don't want to just enter that. You don't want to code that into your accounting platform, see whatever the bank details and just pay it. You don't want to take that risk. Definitely do an ABN check and verify the bank details via a phone call.
And one of the other things I've seen as another layer to protect is the banking platforms themselves, the business banking platforms, which is kind of the layer that sits on top of the accounts. If you add a new bank account to pay to, request another layer of verification. As you said, that's the manual back end, which is make sure you do these things. But the platforms themselves often won't permit you adding a new account to pay to unless it's been verified by the account controller or manager.
That's exactly right. So the final authorization of the approval of that contact in the bank would be the owner as well. So they would a notification even on their phones or when they log into their banking platform Mix, it will pop up as a notification saying, hey, this person has been created and this is the first time this transaction will be going through. Can you please verify it? So that's another extra layer which helps us prevent these fraud activities taking place.
Awesome. Thank you. And moving on, we've got some regular information coming in and we're making decisions based on that regular information. And what do we need to be thinking about next?
I think, Todd, the other thing is the non-financial data. The non-financial data are some key areas in a business on how you want to track efficiency, utilization. And this is something that we do really well on building custom dashboards. Every practice is different. Their focus is different. Everyone sets different goals. Everyone's priorities is different. And what I'm trying to say there is If you're a bulk billing practice, private billing is not important to you. But if you're a practice who wants to focus on driving private billing, then that's important to you. I've listed down a couple of dashboards that are very commonly requested by us, by our team to build for them, because again, the importance of this is tracking that utilization and efficiency in separate departments that lead to that financial impact at the end. So the most common dashboard is we build something called a clinic tracker or a clinic dashboard. And that's the KPIs driven on that would be those weekly stats that I mentioned before. So these dashboards that I'm about to mention are weekly dashboards. And again, we build this to keep a pulse on what's going on in the practice. And in that clinic dashboard or clinic tracker, you would see, like I said, the appointments, the GP hours, the patients per hour, the new patients, and that could be your starting point to give you an idea of the trend of the volume of patients coming through the door. Even tracking something like phone calls. The reception team is constantly busy all the time. How can we help them reduce those number of phone calls? If a practice is getting 1,000 or 1,200 calls a week, what are the commonly asked questions that are coming through the phone to reduce that burden on reception? Because or to get them to spend more time facing with the patient rather than hanging on the phone. So that's a starting point on building a dashboard there. That's one of them. The next thing is room utilization, room cost. And again, this has been very popular now where as an owner, you want to find out if I'm giving this room to this particular GP, how much is it costing my business? How much is it going to cost? And that includes the IT. Some practices say, Ryan, feed in the medical supplies as well, feed in everything, the admin support, the nurse support. And you want to understand, okay, if this room is costing me $10,000 for this month, this doctor needs to bill X amount to get that. So that gives them an idea. And then they go and have those valuable conversations with the doctor saying, hey, just want to let you know that we are providing you this service. And it's not about just discussing the cost factor of it, also improving the facilities and services that's being given to the doctor. And they're making their workflow easy. There are some cool tools now in the industry where you get AI driven into notes. You've got something like Stream Decks, like a cool web camera coming on place, just a cool workplace, which you didn't see this 5 years ago or 10 years ago. You want to come into a high-tech environment, even as a doctor, and be comfortable and work smart. So all these aspects is considered by tracking that room utilization, room cost. Because a doctor might work 12 hours a week and take up an entire room. And then hang on, there is more time there. And as an owner, you might think, oh, that room's dedicated for this particular doctor. But you could squeeze in a couple of more doctors in there because that doctor is only doing 12 hours where you'd be utilizing that another 25, 30 hours max easily. So identifying that is by analyzing that room cost and the room utilization of the doctors. And another couple of requests that have come to us recently is stock analysis as well. Reason is there is a lot of stock wastage taking place. People tend to buy stuff in bulk as deals, but sometimes end up chucking the entire lot and it becomes an entire waste. So you want to track that movement of the stock. Is there a lot of wastage taking place? Why are we reordering products that we already have in store as well? This responsibility and accountability should be given to the head nurse of the practice. They are the people who are driving that side of things, and it's important that you keep them accountable, and it's our job as bookkeepers behind the scenes to track that flow. Track that. Some people speak to me and say, hey, Ran, are there actually systems out there doing this? At the moment, or there isn't a system in the medical that's tracking the stock perfectly. Like if you take an industry like the hospitality, they've got some cool platforms out there, but the medical industry is still developing this. And also to make things easy for a nurse, you want to simplify it and you just list down all the items. What is the quantity? What is the unit price? And track the actual stock. So where do you start? You start with what you have on the floor at the moment. What's the stock you have at the moment? And then you keep continuously monitoring this and track the movement. And the other one that is analyzing each GP's performance separately. And why is an important thing? Because you might look at your practice and you might think, oh, we are averaging 15% on chronic disease management. But it could be 2 doctors actually driving this. And the other 5 doctors on board is actually not interested or not done any CDM. So how does that come to light? You pull them all separately out and be like, hang on, this doctor is making X amount of dollars per hour compared to another doctor. So that doctor could be working extremely hard and coming at 8 in the morning, leaving the practice at 7 in the night. And then you might get another doctor coming at 8 and leaving at 3 in the afternoon, but billing the same thing because they're actually optimizing their billing. And key insights that are pulled out by analyzing each doctor separately. Then again, you can go up to the doctor, hey, you're actually working 12 hours generating X amount. You can work the same amount of hours and generate much more revenue than that as well. The last thing that I've seen is the chronic disease management. Chronic disease management is a very, very crucial dashboard that we build. And the reason for that is because you want that department to self-sustain. That CDM nurse driving those care plans on like at least 8 to 10 per day on average, which is sometimes the nurses might say, oh, I'm actually taking an hour and 15 minutes to do this. Actually looking to the workflow to see how we can simplify things. And that's by the income coming through the chronic disease, the opportunistic patients that are coming into your practice on day who have just coming for a normal consultation who can be converted into a chronic disease management plan. So those are the things you want to track because that's you want to make sure that that nurse is optimized and utilized properly.
Yeah, it's interesting is that, I mean, what you're really talking about is if anybody's listening or watching and you're thinking about what's my favorite sport, at the end of the day, there are two types of data and stats that come for your sport. The first thing is the team stats, and amongst that is did you win or not? But then in amongst there will be individual player stats. And sometimes, as you said, the work can be done, the win could be accountable or attributable to one or two of the key players, and the rest of them might have been coasting in that particular game. And so this is the same. You say, okay, overall, we've got a data set. What does it look like at the individual player level? And what can we do to influence that? And then just holding people accountable for that. I mean, a lot of this data they could get through existing platforms, of course, but narrowing the scope of what's focused on and bring it back to just those few things means that it's much more likely that people focus on it. No, you focus on it, but make a difference, make some kind of impact.
Exactly. And if you don't mind, Todd, I might jump into, because you mentioned there are some cool reporting tools out there as well that do track this. And yes, we do use them. I might jump into a couple of software tools that I think will be. Now, usually when any person that as an owner, you go into a conference, you hear all these cool tools and systems there, they tend to jump into the idea. And one of the things that I want to mention here as well is whatever I'm explaining right now, it might work for your practice, it might not. So what the tools that I'm mentioning, please do not by listening to this, because it might not work for you. It might not fit. But I'll just walk you through a couple of common platforms that I see that's been used in the medical practice. That's, again, it helps save time, resources. It just moves out of unnecessary work. I touched on Dext and HubDoc, and that's the invoice management system. Again, HubDoc is a free version given by Xero, and then we have Dext, which is a paid version. Ideally, so we use Dext as the paid version because there is some cool functionalities built into it, even though it's a paid version there. I believe that the cost outweighs the benefits that are driven by that platform. So again, using this, you can even use your mobile phone and grab a photo and send it, grab a picture of it, and it will automatically go into the approval system. And from there, it just goes into your accounting platform. The process takes less than 5 seconds. Whereas in the past, you would see people putting everything into a file, scanning them at the end of the month and sending it or every fortnight. So you want to make sure that you're utilizing systems like this in managing your bills. And then coming to an accounting platform, 9 out of 10 practices use Xero. And there are practices out there that's using MYOB. However, I still would recommend anyone, if you are using those platforms, I highly recommend shifting gears to Xero. And people ask me, hey, why are you saying this? Why Xero? Why is everyone using Xero? And the reason for that is it's simple. It's simple. You don't need to be an accountant. You don't need to be a bookkeeper. You as an owner. And if you want to get some insights from your accounting platform, the resources are available even on YouTube. And you can just YouTube it, you just can Google it, and it will give you guidelines on how to run certain reports, and you can get an idea of your business. You don't need to wait for your accountant or your bookkeeper to send them that profit and loss, to send them that cash flow. They've made things so simple. And then the other thing is, in the industry as well, every system that comes out first speaks to Xero. They first make sure that their API is connected to Xero, and they perfect it, linking it to Xero as well. So there are a lot of cool features in the platform. It's super easy to use. You don't need any crazy degrees to use something like Xero, and it's really easy. The other one was Cubico. I highly recommend using Cubico as well. They're a reporting tool which connects to your PMS, and they pull some really cool insights. So yeah, and why Cubico? So the reason for Cubico is because you can get certain information, let's say logging into best practice and going through reports. Collating all of that into one place can take you hours, days, or weeks. Now, Cubico has simplified this entire thing where you just click a couple of buttons. You can modify each doctor, date range, filter anything you actually want, and it gives you accurate information and in a timely manner as well. So I highly recommend this, especially when you're building those custom dashboards. Again, why are we building those custom dashboards using Cubico? You want to have those important conversations with the client. There are some practices who have signed up to these platforms but never look at them as well.
In fact, that's really common, right? That people actually sign up for all sorts of tools and never actually schedule the time to begin. They don't actually know how to look for the data and then the story behind the data. So sometimes someone says to them, you should look at this thing, and then they look at it for a brief period of time. I've had lots of conversations, Ryan, with owners where I say this or this basic data, patients per hour, revenue per encounter, the kind of the baseline expectations. And a lot of the time they'll say to me, it's in Cubico. Well, it's not much good in Cubico. You need to know what it is. So yeah, this is a big deal, right? Having it is not using it.
Exactly, Jordan. And one of the things, when someone mentions that to me, I'm like, do me a favor. And yes, Ryan, tell me what let's do. Bookmark Cubico. Bookmark it, put a calendar request on your calendar every week. At least start with once a week looking into it. And if you bookmark and build, at the start, we'll help them build even a favorite dashboard, what's important to them. And then once you bookmark that, all you need to do is click that. Making it super easy, simplifying the entire process, and utilizing that tool, because it's an extremely powerful tool that gives you some really cool insights about your business. So those are some tips, because like you mentioned, Todd, everyone's signed. There are a lot of people out there who have signed up for it. If you ask them the question, oh, yep, that system's got it, but I've never looked at it. So you want to make sure that they look at it regularly. The other thing is Surgical Partners. Surgical Partners is a platform that helps for your doctor's distributions or calculate the service fee percentages. So again, please do not listen to this and go and sign up to any platform, because it might work for you, it might not work for you. I'm talking about every platform that I'm mentioning here. But that platform has perfected calculating the GP distributions. We have also Automed. Automed is known to be a booking platform, and now they've integrated the tenant service fee arrangements as well. It's a different functionality, but it's just something that's coming to play in the recent time. So I'm not sure if you've heard of this. It's something called Wheel, Todd. So what is Wheel? It's a digital debit card, a virtual card system. And again, I might give you a small example here. The wheel becomes very, very important in managing petty cash. And the danger zone in a medical practice if you are using cash to manage petty cash in the business. Again, Todd, I have to mention that era is over. We don't highly recommended to use cash. And this is for postage. This is for buying your milk. This is buying the day-to-day staff amenities in a practice. And usually what they tend to do is they'll pull out, let's say, $500 from the cash that has come into the practice. A big no. You should never do that. So, or else what they'll tend to do is they'll put in $500 of cash, and then they'll start spending that cash and keeping a track of all the receipts. Again, in the practice manager's desk somewhere under some file, which is super defined, and it'll come out once a month. So I don't recommend using cash for petty cash management. Trust me, there are still practices out there doing that, but it's a high risk. And the reason is It's a struggle to track it. There is no control over it. You need to give that to if it's a manager or a reception staff member, you need to give them that cash. And handling cash is just not a thing in today's world.
It's just unwise, right? I mean, at the end of the day, the $50 that belongs to the practice looks exactly the same as the $50 that you got out of the ATM that's yours. And so that's the problem, right? It could easily be spent or misused, not even as intentional abuse or misuse, just accidentally, or as you say, unaccounted for. You get a receipt, but it's in your wallet or your purse for a while, it just gets turfed out. You just forget to log all this stuff. And that's the challenge with it.
Exactly. And that's where Rio comes handy. And Wheel is a virtual card system. You can link it to your phone, like your wallet on your phone. It's not a physical card. I have to mention that, but it acts like one. It's accepted anywhere. And all you need to do is you can go, let's say you're going to buy milk for the practice. You just go tap the card, purchase the milk, tap the card. And immediately as you tap that card, you'll get a notification saying, hey, you need to add in the receipt into that transaction. That's another reminder system. And you don't need to keep a track of your receipts. All you need to do is instantly grab a photo of that. It'll upload into that app, which goes directly into your accounting platform as well. So it's so seamlessly, it saves so much time. And then the minute you've taken a photo of that receipt, you can shop that receipt. You don't need that. We've got the digital version of it. And it makes the next day you've got the transaction coming through your accounting as well. You don't have to wait till the end of the month to get an Excel spreadsheet of the petty cash management taken place.
So Ryder, you're telling me we all missed out on the joy of going and thinking, I've definitely got that receipt. You go and look for it, and it's thermal paper, and it's sat in your car on a hot day. It's completely grey. And you're like, shit, I know it was about $40.
And the cool part is, in case you forget for that meal, let's say you bought a couple of coffees for your team members and you're running to give that to them. You've got a busy meeting coming up and you've missed the notification. That's funny. It will keep reminding you really as well until you actually add that receipt into that transaction. Just because you forget it at that point doesn't mean that it's forgotten. It will give assistant thought. So I think it's pretty cool because especially on a Monday morning, people tend to it's a lot going on in the practice, and these are just small ways on how to change the environment, improve efficiencies. And one last platform that I had was Fathom. Fathom is a management reporting tool. It presents data to non-financial people in a much presentable manner. And that will give you an idea of trends. It will give you graphical representatives of your revenue, it could be your government incentives, your WIPs and clinics, just to get a trend, which doctor is billing the most. You can break it down, whereas sometimes that's a bit limited in your accounting platform. And whereas this will give you a really good insight, and you don't need to be financially savvy to understand it as well. Even when it breaks down your expenses really well, it'll give you the top highlighting expenses. It'll give you a bit of a cash flow analysis. It'll give you a break-even point. So there are some cool features in that tool as well. These are some tools that I got and some software there. But like I said, I don't recommend you going and signing up for any of these things. There are some cool payroll platforms as well, which I can recommend Tanda and Deputy. They integrate with the awards. And it helps you not worrying about that. Because you are not paying a staff member based on the award, this gives you a warning. So these are all headaches that you would see once a year, everyone sitting down, you with your HR consultant, going through a full review, putting a list of all the staff, their pay rates, all that's actually taken away when you're actually using a reliable platform like that.
I like having the systems do the work makes sense, right? We have a lot of good features, but one of the negative design features is that we're easily distractible. And so because our attention might be on something else, something that's really important might fall away. And if a system kind of reminds you that you need to get the information in, get the data up to date, then that's going to be great. And if you've got that backed up by people that are waiting for it on the other end, then that's even better. Hey, Ryan, I'm just going to touch on, we've talked a lot about uploading invoices, which means that we're paying a lot of people. And one of the things in business that's a frustration is if you're paying more than you should. I've always thought that accountants and bookkeepers are really well placed to kind of cross shop and tell me, am I being ripped off? Or could I do better on this particular type of agreement? Do you do anything in that space in the bookkeeping?
Hey, if you're a general practice owner, I have a question for you. What would an extra $50,000 in profit mean for your practice? More stability, more freedom, more impact? In just 5 days, from the 24th to the 28th of March, 8 a.m. to 9 a.m., that's 1 hour a day, I'm going to show you how to find $50,000 hidden in your practice, build a 5-star team, and free up 5 or more hours per week. No fluff, just real strategies that work. We're only taking a limited number of general practice owners, so click the link in the show notes and join us now. It's your chance to take control of your practice's future.
Yes. So we do work with a couple of suppliers as well. And I'll walk you through an example. If you've been signed up for your insurance, your business insurances, management liabilities, public liability, all those insurance you've been signing up, you have signed up and you've just renewed it every year, been paying a fixed amount. And then what I have noticed is sometimes when we jump in, we quickly have a look at it and be like, oh, actually you've paid $12,000 this year on your insurance for this stuff. Now, when it comes to insurance, sometimes it might not be a cost. You might not have a cost saving, but you can pay this amount. Let's assume, I'm just throwing numbers out there, but let's assume you're paying $12,000 for the year and get more value. So we work with suppliers where we can get a couple of quotes for you. And when it comes to something like insurance, mostly what takes place is it's not a cost saving, but more value being driven and more additions being added onto your insurance layer in your practice. So like that, similarly, if printing is a big one, Todd, because people tend to get really frustrated when the printer breaks down. So what happens is a cartridge jammed or something, you will get a person coming and fixing it. They'll spend 5 minutes, the job's done. Next day, again, it's broken. And this could be a very annoying thing, especially when there is a lot of paperwork that's being managed at reception. And when the printer lets you down, that could be an issue. So there are 2 ways of looking at this. And again, we work with multiple suppliers here where we'll look at your printing cost. Printing cost might be low, but your repairs and maintenance cost on printing is significantly high. And in Todd, what I've noticed is that might not be reported correctly. That's being coded repairs and maintenance, but not considering it to be a printing expense as well. When you actually break it down and have a look at it, you would see that you're paying a significant amount to maintain those cartridges and the repairs and maintenance on your printing. We work with suppliers where they'll come in, see how many printers are on the ground, and give the practices better deals. So there have been deals that we have put across where we have saved within a period of 2 to 3 years over $10,000 as well. And that's some really cool cost savings. And also you don't have to pay out for any call out fees. There are mechanisms where they will take care of the repairs and maintenance. And if that particular machine is giving you too much trouble, they'll just replace the machine for you at no additional cost. So these are some examples start on the procurement side of things, on the cost savings opportunities. It breaks down into electricity, printing, insurances, even something like cleaning. Even cleaning, there are suppliers out there who, again, it really depends because you don't want to pay a very low amount and not have a good job. So there are cost savings, but it's important to analyze because it comes into play of looking at the value that you're going to get out of it as well.
Exactly. And I think even just knowing, you don't really have a way of knowing what's valid other than if you spoke to sort of 2 or 3 suppliers, but it doesn't give you the context of overall, is this reasonable or not? And so I think even just somebody intentionally benchmarking your overheads and then cross-shopping them or taking some action on it is great because I don't know about you, but most of us at home have things that are like, you know what, I really should go and check. Is there a better deal for my car insurance? Is there a better deal for my mobile phone plan? Could I be with a better power provider? Like all those things at home, often think you don't necessarily find the time to do it. So again, in business, all of those bills are just higher. So it makes sense that somebody should be looking at that on the back end. And then you've got some confidence that actually I'm probably paying about the fair rate for these. It's not about necessarily the cheapest, as you said, because in most cases, these are commoditized services in that nobody really cares where your power comes from necessarily. And some of those other things will be similar. But yeah, I think that's great that on the back end, you can have some confidence that those areas are being checked and that you're paying a fair rate for those. I think that's awesome.
No, just one other thing that came to my mind is even telephone and internet or even your IT services. Now, when you start having those conversations, you think, oh my gosh, man, just imagine changing my IT. Just imagine changing my telephone. They are big projects, they are big headaches, and it's not stuff that can be changed within a day. It takes time. There's a massive process behind it. However, the suppliers that we work with actually come onto the ground, do that work for you. All they would need is the breakdown of the numbers, the breakdown of the users, and they do the back-end work. And when it comes to those services like telephone, IT, internet, there are cost-saving opportunities there as well. There is value, but there is also cost-saving opportunities, and you would get a better deal. So it could be a nightmare in your mind saying, oh my gosh, this is something big. Ryan saying that we can save $1,000 a month. $1,000 a month is $12,000 for the year. Over 2-3 years, that's a significant amount of money on a big project. And definitely you will be looking at saving over $1,000. That's a bare minimum. So even those projects are significant, it is sometimes worth going down the path of actually really taking it seriously and looking at it, because there are some massive savings and benefits to it as well.
Yeah, I think, Ryan, people can easily overlook this. So, for example, if a business runs a 10% margin on billings, which is 8 to 10% fairly close to the average, if you like, that means that if you're saving $12,000 a year, that's 120 grand that you don't have to bill to retain that. It's a reasonable chunk of work for a GP. I think it's important to get the right frame about the best money is the money you don't spend, stays in your pocket. That's always great. Hey, let's jump to one of the things that I think is really cool about GP Bookkeeper is the Profit First accreditation. Talk to me a little bit about what Profit First is and what it means in the context of being a general practice owner.
Yeah, so Profit First is pretty much managing your cash flow using your banking platform. And I'm going to call it a bucketing system because sometimes you would have accountants and bookkeepers out there who don't agree with this concept. They tend to rely on the Excel spreadsheet of managing their cash flow. Certified Profit First professional that believes in managing the cash using different bank accounts. And I'll walk through why I think it's important. So ideally, you want to create a different number of accounts, and I might give you a bit of an idea what those accounts are, Todd, as well. Then at the end, I might give you a walkthrough on where we get started. So the different accounts that we like to get set up is you want to create a profit account. You want to create an obligation. Now, what's an obligations account? It's paying your tax bill when it comes to you. And then you want to create an owner's pay account. You want to create an operational expense account and a corporate tax account. So this is your starting point. You want to create these different bank accounts. And that conversation comes here. First of all, it's a headache creating these accounts. It is. At the start, it is painful going to the bank, signing those forms and creating those accounts. The relief and the gain and the outcome of this management, you would see it after a couple of months. You don't see results in the first month. It's important to be patient. It's important to let the flow, because you need to be disciplined in this process. It's important that cycle, that flow, do the work. Come end of 3 months, you will see in crazy outcome. Like it's going to be incredible. And then you're like, why didn't I start this before? So I'll just give you a bit of a walkthrough. Cash is key in any business. And when we run our reports, when we run the profit and loss using our account platform, we might see $25,000 worth of profit get made. And as owners, we log into the bank account, we don't see the $25,000. Like, hang on, where did that cash disappear? Those are common things. And then comes tax time. At the end of the quarter, you get this massive tax bill. Man, I don't have the cash to pay this. These are really serious conversations. These are really stressful events as owners. And if you're a GP who is an owner, they actually sometimes take pay cuts to pay that tax bill.
Even funnier, Ryan, is the timing of the PIP, PNIP, WIP, whatever we want to call it, comes at roughly the same time. And so people wait for one payment from the government and then it just changes hands and goes back to the government with the other hand.
You won't be surprised at how many practices rely on that. And that's because of poor cash management. Now, with Profit First, they focus on profit. And I'll walk you through a couple of things. So in a basic accounting equation, it is sales minus expenses equals profit. That's ideally the usual accounting equation. What happens in that? Profit is kept last. So you tend to grow your business. As an owner, your revenue has grown from 1.5 million to 2 million to 2.5 million. Without your knowledge, even your expenses tend to grow, and sometimes at a bigger rapid rate than the revenue. But you don't tend to see that, or you don't tend to understand that, because as an owner you want to grow the business. That's buy another practice. I've got another doctor on site utilizing another room in my practice, but behind the scenes you've hired another 3 staff members to facilitate that. So along with growth comes expenses as well, and that's why sometimes that, and me being an accountant, that's why that equation, accounting, the sales minus expenses equals profit. Profit focused at the end. Now, what profit first does is they modify this equation a bit. Sales minus profit equals expenses. The focus is on profit. Every single business owner wants to run a business. It's not a charity. You don't want to run losses in your practice. You want to make sure you're making some sort of profit out of it. And practices out there who are not making any money at all, you start with at least 1%. And you want to allocate at least 1% of the money into your profit. That's the reason for running a business. So they really focus on that equation where they prioritize sales minus profit, and then expenses being at the last, where profit is focused at the start. So today I might just give you a quick walkthrough as to how we get started with this and how you set it up. So first step will be setting up those different bank accounts. You want to negotiate with your bank and not have any bank fees going through those accounts. And ideally, 99% of the time, the banks will set that up for you. Setting those bank accounts might take a bit of time, couple of weeks, sometimes even 3 to 4 weeks, depending if your relationship with the bank. There will be a couple of forms that you need to fill out. And then behind the scenes, your accountant might be wondering, hey, why is this guy gone and created all these different accounts, which is unnecessary? And they might not understand the concept or the principle behind it. But what we're going to do is then at the start, we're going to run something called an initial assessment. And what that initial assessment does is it takes out your numbers for the last 6 to 12 months and identifies your numbers based on how much tax have you been paying? What are your operational expenses? How much are you as a business owner getting paid? All these things get broken down, and you tend to understand a certain percentage out of the whole income. What are the percentage of these cost elements? So how much money are you allocating on a monthly basis, on a day-to-day basis, on a weekly basis for these operational expenses in your business? And you break your business down. So once you do this, the scary part is you might think, hang on, I don't have...
Where's all the money going? Yeah, you know where it's going.
Exactly. You're like thinking, no wonder I don't have money to pay my tax bill. Even though I'm generating this much of profit in my profit and loss, how come I don't have that in the bank? And as owners, we tend to log into the bank on a daily basis. You will be surprised the number of business owners logging. They'll just take their phone out, log into the, look at them. They tend to think, oh, I've got X amount of in the bank and my business is doing really well. But it's actually not. It's all been hidden under one account, and hence why you want to break it down. And I might just wrap up here by just giving you a couple of tips. The beauty of this model is you don't need to be a financial person. All that you do is anytime you log into the bank, you would see these different 5 bank accounts and money being put into them. And then exactly, okay, in my obligations account, I have 10,000 and we start that not at the end of the quarter. You start that at the start of the quarter, so that when it comes to the end of the quarter, you've got sufficient cash sitting there. When that tax bill comes, trust me, I've had many business owners be like, Ran, let's pay this ASAP.
Let's pay the tax early.
Officer, because we've got the cash sitting there. No one's waiting for the pips and whips or PNIPs to come through. It's stress-free. And as owners, when they log into the bank, you get a good breakdown. Okay, I've got this much of money in my operational expenses. I've got this much into profit. And it might not be a significant amount that you're putting into your profit account at the start. You do this for the first 3 to 6 months. This has been rolled out to multiple clients in GP Bookkeeper, and they never reverse it back. They're like, this is amazing. This is a life-changing game. However, the trick is people don't like change. Humans tend to where they're not very good when it comes to change and disciplining yourself. It's important that you discipline yourself. And if you set targets, you have to make sure that you follow that. Let's assume you're putting money in an operational account, and you comes to paying your bills, you don't have the money sitting there. You as a business owner needs to start making some serious decisions. You don't want to take money from another account. You don't want to rob money from that account and top up this account and think, oh, I've got money there. I'm just going to. That funds are sitting there for a set purpose. So these are some, it's important as humans, sometimes this change is a challenge. We need to be disciplined and don't expect results instantly. It takes time. The cycle of moving money is, I recommend doing this on a fortnightly basis. You can time it based on a staff payroll or a creditor pay run. You can time transfers just before that, so that then you have money sitting in all the accounts. And at the end of that 6 months, 9 months, you would see your profit account growing. You would see you making some massive changes in your business. You would see as an owner, you're getting paid. You would see you'll be paying your tax bill on time, Todd. And it's just a remarkable system out there, which I personally follow in my personal life as well. And now I'm doing this to my clients, and they have never gone back from me.
That's awesome. It sounds a lot like Scott Pape, the Barefoot Investor's personal advice in business. And we know in business, this was Mike Michalowicz, an American guy who has got a book, Profit First. Hey, Ryan, just before we finish up, the last thing I want to ask you is message for general practice owners. If you got one message for them, what would it be?
I think, Todd, my main focus is, which I always tell my clients, which I always tell the business owners, is don't let go of the financial position of your business. Keep a pulse on it. Always monitor. The numbers tell you the story. Track those weekly stats. Track those fortnightly cash flows. Discipline yourself. Make crucial decisions. When you see something not happening, if, like, say for an example, if you're recruiting doctors, just don't go down the path and recruit more staff members as well. You're going to go down into the same boat you were before. And all that comes together where the numbers tell you the story. And always make sure that you are looking at them as a business owner. It's very, very critical. It's very crucial, because looking at it on every quarter or every 6 months, or when your accountant sends you the financial returns at the year end, you're like, hang on, I did all this hard work and I didn't make this. I thought I was doing this, but the result is something else. So the main thing, Todd, is keep a pulse on those numbers regularly. And it's not just financial, but the non-financial side of things, to make sure that your business, those wheels in your business are turning smoothly.
Great advice, Ryan. I think it's really easy for doctors who are obviously clinicians first and foremost to focus all their time on seeing patients, and their patients win, their staff win because they're getting employment. Everybody else does well, but what happens is they're not watching the finances. And so at the end of the month, at the end of the quarter, at the end of the financial year, they find out they're short. And so what they do is they just work harder, and the owner is worse off than a contractor or a tenant doctor or an independent GP, whatever you want to call them. They're worse off than one of those in their own practice. And so that's something that we don't want to see happen. Thank you for your time, Ryan. Really appreciate it. And if anybody needs to find GP Bookkeeper, I presume they just Google the name. They should be able to sort you out. We'll make sure there's something in the show notes, and we'll chat again soon. Thank you, Ryan.
Thanks, Todd. It was lovely to be here. Thank you, everyone.